Hello, everyone. I am a volunteer with For a Safer Space. Today's presentation is about postpartum depression. I would like to begin this presentation with a land acknowledgement. And this is for Toronto, where the Dish with One Spoon territory is located, as well as Toronto Metropolitan University. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Today's agenda will include an introduction about postpartum depression, the symptoms, the risk factors, treatment options, and lastly, the conclusion. What is postpartum depression? During and after pregnancy, some women experience numerous physical, emotional, and behavioral changes. Post-pregnancy can elicit a wide range of emotions, which then can lead to depression. After childbirth, most new mothers experience postpartum baby blues, which includes mood swings, crying spells, anxiety, and difficulty sleeping. Baby blues typically begin within the first few days of giving birth and can last up to 2 weeks. Some new mothers, however, experience postpartum depression, a more severe and long-lasting form of depression in which they feel hopeless, empty, or disconnected from their baby for more than 2 weeks. It's also known as peripartum depression because it can begin during pregnancy and last after childbirth. Symptoms. If a woman experiences any of the following symptoms for more than 2 weeks, they have postpartum depression. Feeling restless or moody, feeling sad, hopeless, or overwhelmed, crying a lot, having thoughts of hurting the baby, having thoughts of hurting oneself, not having any interest in the baby, not feeling connected to the baby, or feeling as if the baby is someone else's baby, having no energy or motivation, eating too little or too much, sleeping too little or too much, having trouble focusing or making decisions, having memory problems, feeling worthless, guilty, or like a bad mother, losing interest or pleasure in activities that one used to enjoy, isolation from friends and family, and having persistent headaches, aches and pains, or stomach issues. Risk factors. Postpartum depression occurs for a variety of reasons, which vary from person to person. These factors can increase the risk of developing postpartum depression. A history of depression prior to becoming pregnant or during pregnancy. Age at the time of pregnancy. So the younger a person is, the higher the chances. Ambivalence about the pregnancy. Children. So the more the person has, the more likely they are to be depressed in a later pregnancy. Family history of mood disorders. Going through an extremely stressful event like a job loss or health crisis. Having a child with special needs or health problems. Having twins or triplets. Having a history of depression or premenstrual dysphoric disorder. Limited social support. Living alone. And marital conflict. Treatment. Given that postpartum depression can have serious health repercussions For both the mother and the child, it is important for the mother to seek out treatment. Therapy, medication, or a combination of the two are frequently used to treat postpartum depression. Brain stimulation therapy, such as electroconvulsive therapy, may be a possibility if these treatments are unsuccessful in symptom reduction. Medications include antidepressants, and therapies include psychotherapy, cognitive behavioral therapy, and interpersonal therapy. Now we'll go over resources. The most important thing to take away from this video is that there's support and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you'd like to reach out for support. That concludes the presentation on postpartum depression. Thank you for watching.